Good afternoon. This is John Adams, the Rehab and Documentation Guru, on a rainy December, Friday the 13th. I like that day. And I was asked by one of my subscribers to do a video. Well, she didn't ask about a video, but she asked a question, which means I give a video, on goals for coordination, more specifically long and short term goals for coordination. So, first and foremost, let's talk about what coordination is. It is an underlying impairment. It causes functional problems. We know in the functional categories that physical, occupational, and speech therapists work on, coordination can play a role in pretty much everything that we do with our patients on a functional level. So coordination is an underlying impairment. It's a cause of a functional deficit. Now, in order to be able to write a goal for coordination, we have to be able to measure it. So the first thing you got to think about is, how do you objectify this thing? So many therapists talk about in their documentation the patient has poor coordination or fair coordination, and we really need to get away from good, fair, poor terminology. It means nothing by itself. It's very subjective. It's not reproducible by multiple different therapists generally. So it's a problematic designation. So we have to figure out a way to really objectify it. And going back to the day called school, and I'm not the best person for measuring coordination. I will tell you that. I would ask if you know a therapist that's really good with neuro to give you some good coordination tests. But we learned basic things back in the day called school, like finger to nose to finger, rapid alternating movements, or dysdiadochokinesia. I think I said that right. So we learned some things that we could look at to determine if the patient had coordination. Heel to shin test. And one way to objectify this stuff, like if we do the basic tests that we learned back in the day called school, would be, let's say you did finger to nose, and you did it bilaterally. Well, you could see out of 10 repetitions, how often did the patient accurately hit the tip of their nose? Let's see if I can do it. Okay, I'm doing all right, so maybe I'll stop. So anyway, out of, let's say, 10 repetitions, the patient missed on 8, kept missing. So that would be a way of objectifying it, to have that quantification, therefore to write a goal for it. Now, what would be the purpose of touching the nose? Is that indicative of anything functionally? Well, it might be, when you're talking about, for example, grooming and whatnot. So maybe we could coordinate that with that measure with doing a goal more specifically to a function related to grooming and whatnot, and more subtasks like shaving and washing your face, where you need more accuracy to be able to do that activity, that functional activity. So we would take that measurement, like finger to nose, and just put it with a function that corresponds with it. And there are standardized tests that, in a sense, will capture some coordination potential. For example, even doing something like the tug, getting up from a chair, walking around an object 10 feet out, coming around and sitting on the chair again, requires a level of coordination, but you'd have to describe what the coordination issue is. A functional task by itself can have evidence of observational problems with coordination. So let's just say straight line walking. If the patient is scissoring, we would say that they have a coordination issue with walking, and we could also quantify that. So let's say on 5 out of 10 steps, or every other step, the patient's scissoring, and then every other step they're not. At least we have a way to quantify that coordination. So first thing you got to do is figure out how to objectify the measurement of coordination. And then, as far as assigning it to short-term and long-term goals, well, it's pretty straightforward. I mean, we've got long-term goals are generally going to be more function-based. So, for example, I want the patient to complete an activity independently. That is their long-term goal, and that's going to be a functional issue. But on the short-term side, I'm going to be a little bit more specific and detailed. So I might use that underlying impairment measure, that coordination issue, in conjunction with the function. So let's say on 50% of the patient's steps, they are scissoring, and that's causing them to require min assist for gait for safety because they lose their balance. My goal short term might be that they'll scissor on only 3 out of 10 steps, and that'll allow them to be contact guard, let's say. I'm just making stuff up. What about self-feeding? Coordination might be causing them having difficulties bringing the food to their mouth, and so we might take that coordination measure, associate it with a self-feeding goal, and say, okay, on so many trials of bringing the food to the mouth, the patient will be successful in getting there, because right now they're not getting it to their mouth successfully, and they're spilling each and every time they try to feed themselves. So that's how I would associate coordination with a goal. Now, I have advocated in my courses that you write goals that are specific and measurable to the function and the underlying impairment. So in this case, whatever the functional problem is and the coordination measurement, putting them both in the goal. However, it is possible that you don't have to do that as long as you remember to measure that, because when you treat coordination, so let's say coordination is the underlying impairment causing the functional deficit, when you treat it, you have to have a way to measure it on an ongoing basis. So if you don't remember to measure it because it's not in a goal, then it becomes a problem. Like neuromuscular reeducation, one of the things it addresses is coordination. It's one of the 5 things that NMRE covers. So I've got to make sure if I'm billing neuromuscular reed on a regular basis, I get that objective measurement of the coordination. Very objective, very descriptive, and goals prompt you, remind you to keep doing that. So short-term goals, I'd probably be a little bit more specific about the coordination. Long-term goals, I'd probably, in this case, keep it a little bit more functional. But you could, like if the patient's missing 50% of the time on finger to nose, you could have a goal that they'll be 100% for a long-term goal, which means they've got now intact coordination for that particular measurement. Anyway, I hope that was helpful. Feel free to send me other things you'd like to see in video format or answers. Also, please like and subscribe, because when you like a video, it actually gets viewed more, which is helpful to the YouTube channel efforts, which is my shameless plug. Anyway, take care, God bless, and have a great Friday the 13th.